The Chair recognizes the gentleman from Michigan, Mr. Huizenga, for 5 minutes.
Thank you, Mr. Speaker. I appreciate this. If you thought Obamacare's and the Obama administration's rollout of healthcare.gov was bad, believe it or not, it got worse for another section of our citizens. Back in Michigan, the Second District is home to the highest number of Latino citizens than any other district, any other congressional district in the state of Michigan. And like thousands of other residents across Michigan, Hispanic Michiganders are forced to deal with higher costs, the potential loss of their doctor, canceled insurance policies, all because of Obamacare. These citizens are in need of the same information that we are all in search of. Well, after being delayed for more than 2 months, the administration finally unveiled its Spanish-language website, cuidadodesalud.gov, that contained an embarrassing amount of Spanglish. Even I couldn't come up with that much Spanglish. Frankly, it's insulting that the administration would simply make up words rather than provide an accurate translation of the president's signature achievement. One friend made the humorous observation that it is just as bad in Spanish as it is in English, and nobody can work with it in Spanish either. Well, Latinos are more adversely impacted in many ways by soaring premiums because the median age of the Hispanic population is actually 10 years younger than the national average. Therefore, they are seeing these premiums soar, and as it shifts those costs to younger Americans. These are the same younger citizens that the very folks that need to sign up for this program, as was predicted what would happen, or as certainly is what is needed to try to make it actuarially sound, these are the same folks who are not doing so right now. The focus of the debate instead needs to be on patient-centered solutions that not only lower costs, but deliver high-quality care to more citizens, none of which, unfortunately, Obamacare actually does. I believe it's time to repeal and replace this failed policy. And you know, Mr. Speaker, House Republicans have led with numerous options, such as the Patient Option Act, as Dr. Brown was just talking about, Dr. Price of Georgia, Dr. Benishek of my home state, Michigan, the Republican Study Committee plan. A number of plans have been out there and proposed, and I think would be a far better solution to those things that we can all agree on, having greater access for more people at a lower cost. But I think one thing we can all agree on in any language is that Obamacare is off the mark. With that, I yield back.
The gentleman yields back. The chair recognizes